Today we will be exploring the experiences of what it is like to have sex after going through a pregnancy loss. After a miscarriage or an abortion, the patient must go to their GP or to the ER in order to have a checkup done and have an estimate of how long it will take them to heal. If patients are feeling pain, discomfort, or bleeding that lasts more than 5 days to a week, then these are all red flags. According to the NHS, it's important to wait until all pregnancy loss symptoms have gone before having sex again. And according to the American College of Obstetricians and Gynecologists, it is important to wait for 1 to 2 weeks before putting anything inside the vagina, and that can include tampons, for example. It's also important to wait until you have made a full recovery from any health problems that may have occurred due to the loss or due to something else that might be flaring up. And regarding pregnancy loss related problems, this can include DNC procedures, septic pregnancy losses, etc. And there's no need to wait until after you have your first period post-loss to have sex again, but expect to have your period around 4 to 6 weeks after the loss has occurred, and this period may be heavier or last longer than usual. However, sex isn't just something that's physical, so for a lot of people who have experienced a loss, having sex again can be quite a challenging thing. Some people feel triggered by the experience. They can feel that it's painful emotionally or physically. They can have a lot of anxiety and fear about the experience and the consequences of the experience. They can have a sense of unease, and they can describe it as being different, or like they feel it's a chore, it's something that should be done because they are in a couple, and it just doesn't have the flow that it had before. Things don't seem to be as natural, or they can be lacking in desire, and so the whole thing is just weird and uncomfortable. And here are just some real experiences, real quotes from people who have experienced a loss, and when they started trying to get back their sex life, they noticed that some things were different. I've heard stories of people retreating from their partners, burying their sexuality deep beneath their grief, oftentimes feeling undeserving of or wholly disinterested in pleasure. I've also heard stories of women wanting more than their partners can provide, and they were thinking of new fantasies, and this was something that was new for them. And these potential outcomes do exist, partially because there are so many conflicting thoughts firing simultaneously in your mind, and these are affecting your body. Sex and masturbation, for that matter, can feel like a self-indulgent act that symbolizes an erasure of the grief in favor of emotional or physical or personal gain. But they can also be compassionate acts of self-care and restorative moments for romantic relationships. For the person who is telling their experience, in this case, jumping back into sex immediately after the loss was a sort of weird coping mechanism and an attempt to distract themselves from an overwhelming grief. And so the truth is that people, when they are grieving, they aren't just grieving. It isn't just a one-note song. It's probably a song that has an undertone. It has an undertone of grief, but there are other notes being played. So can pleasure and grief coexist? Of course, yes. So truly, when we are talking about how to explore this post-loss sex world, we are also trying to understand what it is like to be intimate after having gone through a pregnancy loss. So let's start by talking about the relationship between depression and sexual function in women with recurrent pregnancy loss. You have the article I'm referring to on your right bottom corner. Women who had severe depression after their loss or after having had multiple losses indicated lower scores of sexual function, and this was true in different countries, for example, Portugal, Sweden, and Iran. Almost half of the women in the study suffered from some degree of depression, and we can take an example of Iran, in which cultural restrictions and taboos worsened the symptoms that women had. Depression had a significant inverse correlation with sexual function and its domains, meaning that the higher the depression was getting, or the more severe it was getting, the less functional these women felt sexually. They also found that spouses' education level and economic status showed a significant relationship with women's sexual function, and women's depression showed a significant relationship with their economic status. Of course, be mindful that this differs from culture to culture and also from individual to individual and from couple to couple. The assessment of sexual and mental health needs to be a part of the consultation that women have when they go to their doctor with a history of reproductive losses. Whether the patient seeks help for depression and sexual dysfunction or not, this should be included, and this is the point that the authors make in this article. So in order to understand the inner world of the people who go through a pregnancy loss, we are going to use the Lazarus emotions and adaptation model. This model states that people appraise events in terms of what is at stake for them and how backgrounds and life contexts affect their appraisals. An event like a miscarriage may be experienced as benign or stressful. An adaptation to an event depends on how people appraise events as they unfold and reappraise them in light of what can be done about them. Appraisals and reappraisals are the work of adaptation and emotional regulation. Events perceived as benign rarely evoke negative emotional responses or call on coping resources, unlike the stressful events, which are harmful, threatening, or challenging to the person. So the article we're talking about divides the relationships of their sample of women into interpersonal relationships and sexual relationships, and they then talk about three possible outcomes for these relationships after the women go through a pregnancy loss. The relationships may become closer, stay as they were, or become more. At 1 year, women whose interpersonal relationships were as before, or whose sexual relationships were as before, coped less passively and appraised less miscarriage impact. It's also important to state that 44% of the sample stated that their interpersonal relationships stayed the same, and 55% stated that their sexual relationships stayed the same. So it's roughly half of the sample. But it's also important to see that a fewer percentage stated that their interpersonal relationships became closer, and a bit higher stated that they became more distant, and 39% said that their sexual relationships became more distant after the loss. So women whose interpersonal relationships or sexual relationships stayed the same, so we're still talking about those whose relationships remained as they were, and from these people whose relationships remained the same, had a miscarriage at an early gestation stage, showed higher chances of trying to conceive again and experienced fewer negative events. And of course, this is different for everyone, but people who are pregnant for longer periods of time attach more to the pregnancy and connect more to the baby. But of course, people who have been trying to conceive for a very long time are just as attached to a pregnancy that is a week old, so it just depends from person to person. And those whose interpersonal relationships were closer or the same and whose sexual relationships were the same had less disturbing emotions and more emotional strength, and partners who performed more caring acts. Of course, the partners who were, more willing, present, etc., would invest more in the relationship and on their partner's emotional health and stability. But it's also important to see that there weren't a lot of people stating that sexual relationships became closer after a loss. Women whose interpersonal relationships were closer and whose sexual relationships were the same as before had partners who engaged in more mutual sharing, and those whose interpersonal relationships were more distant feared trying again, were unable to share the loss with their partners, and experienced more tension and less love, less communication, and less support with and from their mates. Women who were sexually more distant avoided intercourse, experienced less desire, and saw sex as a functional necessity or a fearful reminder of loss and a source of tension. Distance, though, in both interpersonal and sexual relationships was associated with women's increased emotional disturbance and included feeling more depressed, anxious, confused, and angry. It's also important to conclude that partner support in the form of caring actions and words was a significant positive predictor of women's assessment of miscarriage effects on their interpersonal relationships and sexual relationships. And caring partners served as a protective factor for these women. So very few differences between those whose relationships grew closer or more distant were found in the appraisal of miscarriage impact and in the tendency to cope passively. However, considerable differences in emotions, backgrounds, and life contexts during the year after a loss were found in terms of when how when a miscarriage affects couples, it may stimulate them to grow, or it may stimulate them to sort of crumble and to feel this inability to support each other through troubling times. And when women felt that their male partner or partners failed to do the things that they considered showed care and affection, then they perceived greater distance in their interpersonal relationships and sexual relationships. And when these women perceived that their partners were engaging in mutual sharing of feelings and experiences and they felt heard, then they claimed to be closer. Now we have another study that's also important to mention. It's regarding heterosexual couples. Of course, I believe research should be done in other forms of romantic attachments and relationships regarding how a reproductive loss affects them or changes them. So this study states that a loss is an important negative life event for both members of the couple. There's considerable suffering associated with the loss, and men do grieve. Men experience a deep sense of loss after a partner's miscarriage. However, so far studies have shown that this suffering is less intense than their female counterparts. Grief is related to the quality of communication in the couple for women, as the previous study also showed. And grief is related to the quality of sex in the couple for men. Of course, I repeat, these are just, sort of a bit of descriptive statistics to show what's important, but of course that men feel the, deterioration in the communication, and surely women feel the differences in their sex life, okay? And just to say that these results do not reflect everyone's experience, and they do not reflect the only experience people have, because as we said in the beginning of this presentation, the music people are is not made by one tone. So it has multiple tones, and what the study is showing is just an undertone that may be more prevalent during this time for certain heterosexual couples. So we've explored a little bit how this reality is for women and men in heterosexual couples, and in our next video we will be exploring how to support someone who had a miscarriage and how to support the partner of someone who had a miscarriage. So stay tuned for our next video, and again, thank you so much for listening, and I'll see you next time.